Hey guys, Bob here. I came across this ECG recently, and I thought it would be very interesting to look at, to analyze, and to try to make a diagnosis off of. So, um, yeah, as you can see, the image in front of you, it's an ECG, a standard 12 lead ECG with a rhythm strip we can use to make a diagnosis or at least some ECG findings to help us to be able to treat our patients appropriately. So I will leave this on screen for a couple of seconds. You can pause it, try to find or identify the findings on the screen just like I have, and after you're done, we could discuss it together. Okay, so the very first thing we notice with this ECG, then let's use the rhythm strip, is that this is a sinus um, rhythm, right? It's sinus, it's regular. It's sinus because we can identify P waves on this ECG. This is a P wave, this is a P wave, this is a P wave, P wave, P wave, P wave. Right? You get the idea. This is a sinus rhythm. Okay, so the next step is identifying whether it is regular. We can compare this big box 1, 2, 3, and half, 3.5. Okay, sure. Then let's compare some more 1, 2, 3.5. Right? The same thing for here 1, 2, 3.5 with a little bit from here. So 1, 2, 3.5. Yes, the rhythm is regular, right? So it's sinus rhythm, it's regular. We'd have to calculate the heart rate, which is now going to be 300, right? Divided by 1, 2, 3.5, right? So 300 divided by 3 point 5, 35.5, 3.5. So 300 divided by 7/10, right? 300 times 10/7. No, 7/2, I'm sorry, times 2/7. So this is 600 divided by 7. I'm using the long method. I don't have a calculator on me. So 7 into 60 would get 8, right? So this is an 8. And then 7 times 8 is 56. So we pick up the remaining 6, right? Sorry, the remaining 4, and then 7 into this 5. Good. So it's 85 point something something something, approximately 85 bits per minute. Sorry, I took the long formats, but this could be. Sorry about that. This could be a lesson in mathematics. So yeah. So what are our findings so far? Sinus rhythm, regular, right? Heart rate of about 85 beats per minute, right? Good. What else could we look at? We could look at the cardiac axis. Cardiac axis, we see positive QRS on 1, on lead 2, and on AVF. Shows you a positive QRS complex, right? Very, very easy to see and to figure out, right? AVF, AVL, as well could help. All right, so normal cardiac axis, right? A summary once again: sinus, regular, 85 beats per minute, normal cardiac axis, right? And then the duration of the P wave, about two small boxes. Duration of the P wave, duration of the P waves, right? Two small boxes, normal. Duration of PR interval, right? Duration of PR interval, which is going to be about 3 boxes. Good. That's normal. And then the QRS complex, right? It's narrow, right? But I noticed then the amplitude seems to be alternating. This is the height of one QRS complex. This is the height of the other, the height of one, the height of the other, right? It seems to be alternating. This is something we call electrical alternance, right? It's very relevant to make a very particular diagnosis. All right, so summary: sinus, regular, normal cardiac axis, heart rate of about 85 beats per minute, electrical alternance, narrow QRS complex, normal P wave duration, normal PR interval duration. There is no ST elevation. I'm comparing all the STs I can find and no ST elevation. All right, that's very good. The T waves are upright in every lead except in AVR. That's normal, right? So the only relevant finding here is electrical alternance. And this is relevant to make a diagnosis of pericardial effusion, right? A summary of these findings on the next page. A summary of these findings on the next page, right? We have P wave, sinus rhythm, it's regular, with normal cardiac axis, heart rate of about 100 beats per minute. I had approximated it to 3 boxes, 3 big boxes, but it's more precisely 85 beats per minute. P wave duration less than 120 milliseconds, normal PR interval, narrow QRS complex, alternating amplitude, positive and upright T waves in all leads except AVR, no ST elevation, right? ECG finding of pericardial effusion. This pericardial effusion is defined as collection of fluid within the pericardial sac. What are the ECG findings in pericardial effusion? Alternating voltage amplitude and reduced voltage. Actually, there is reduced voltage in some of these. Like this is reduced voltage. So you could see a generalized reduced voltage, but you could also just see alternating reduced voltage as well. But the QRS complex, you would see one tall, one small, one tall, one small, one tall, one small, and it will alternate in that manner. So I took the liberty of annotating, right? So you could see low, high, low, high, low, high. You could see that in every lead, low, high, low, and so on. Low, high, low. The same way, low, high, and so on, right? So that's it. Very quick, very easy to make a diagnosis of pericardial effusion. I hope you understood the findings I posited in front of you. Thank you.